Hello and welcome to our Transitioning to Medicare video. We will be discussing what to expect when you become eligible for Medicare and the process of enrolling in available health insurance coverage options through KRS. My name is Brian Tolles and I'm a Medicare specialist in the Retiree Healthcare Division. I have been with KRS for 15 years and working in the Division of Retiree Healthcare for the last 11. Don't forget to subscribe to our YouTube channel for all our video releases as well as archived content. Again, search YouTube for Kentucky Retirement Systems Official or visit our website at kyret.ky.gov. We are also on Facebook and Twitter, and I invite you to like us and stay up to date with all the current and latest KRS news. This information we will be discussing today will only be valid for the current plan year, which runs from January 1st through December 31st. What is Medicare? We're going to first discuss some basics to help you know your Medicare A, B, C's, and D's. Medicare is the federal government's health insurance program that's available to most people age 65 and over, as well as others with disabilities. This is a copy of your Medicare card that is sometimes referred to as the red, white, and blue card. It contains personally identifiable information just like your Social Security card, and you must treat it as a very sensitive document. Your Medicare effective date is the first day of the month that you turn age 65. Unless your birthday is on the first day of the month, then your effective date is the first day of the previous month. For example, if your date of birth is July 15th, your Medicare effective date is July 1st. If your birth date is July 1st, your Medicare effective date then would be June 1st. KRS will send out your Medicare enrollment packet via certified mail about 6 weeks from the date of your Medicare eligibility. It will contain all the information you need to successfully enroll in coverage so that everything is effective right on time with no breaks in services. If you have not received a Medicare enrollment packet within 30 days of your Medicare eligibility date, please contact our office. Each Medicare eligible person must enroll in Medicare individually. Typically, people enroll in Medicare when they turn 65 during what's called their initial enrollment period. For initial enrollment, there's a period of 7 months when you can apply. It begins 3 months before and runs up to 3 months after the month you turn 65. Even though Medicare's enrollment period is 7 months, you should start the process of applying for your Medicare the 3 months prior to your 65th birthday to ensure smooth transition when you reach age 65. If you are not receiving Social Security benefits when you turn 65, you will have to call or go to a local Social Security office to sign up for Medicare Part A and or Part B during your initial enrollment period, which is sometimes referred to as the IEP. If you already receive Social Security benefits, you still have to sign up for Part B through the Social Security office. Here is the contact information for the Social Security Administration. Medicare has different parts. Part A is hospital insurance. In general, it covers things like inpatient hospital stays, inpatient rehabilitation facility care, skilled nursing facility care, as well as home health and hospice care. If you're age 65 or older, you're entitled to Medicare Part A if you have contributed to Social Security for the required number of quarters, which is usually 40. If you have not contributed to Social Security for the required time period, you may be entitled to Part A if your spouse contributed to Social Security during your marriage. We invite you to contact Social Security for any questions regarding Part A eligibility. Usually, you don't pay a monthly premium for Part A coverage if you paid Medicare taxes while you were working. This is sometimes called free Part A. If after contacting Social Security and you do not qualify in any way for Medicare Part A, please contact our office and speak to a retiree healthcare counselor about options of coverage for you. Medicare Part B is medical insurance. In general, it covers things like doctor services, outpatient care, ambulance services, and preventative services. Your Part B premium will automatically be deducted from your Social Security check. If you do not get Social Security benefits and you sign up for Part B, you'll get a quarterly bill. Medicare Part B may be purchased whether or not you have contributed to Social Security for the required time period. People of any age who have end-stage renal or kidney disease can also receive Medicare benefits. You don't have to be retired to receive Medicare benefits. If you have questions about how much you may have to pay for your Medicare Part A or Part B benefits, please contact the Social Security Administration. Now for some common questions. Am I losing my health insurance benefit that I have worked for throughout my career in state or county services because I'm becoming eligible for Medicare? The answer is no. You will continue to have the same dollar amount or percentage amount paid toward your KRS Medicare eligible coverage that is currently being paid toward your KEHP or non-Medicare coverage. Currently, KRS offers Medicare Advantage plans through Humana, which we will talk more about in just a few minutes. Will my coverage be as inclusive as what I've had through the Kentucky Employee Health Plan? The answer is yes. The non-Medicare and Medicare coverage options offered by KRS must be actuarially equivalent due to statutes that state KRS shall provide benefits for recipients equal to those provided to state employees for those having Medicare hospital and medical insurance eligibility status. You will see evidence of this when we look at the plan benefits more in detail. The Medicare options are as good or sometimes offer an even richer benefit than the current coverage you have through KEHP. What happens to my dependents that I cover that may not be eligible for Medicare? They can remain covered on the Kentucky Employees Health Plan even though you will be switching over to a Medicare eligible option. What happens to my dependents that are eligible for Medicare? They will be able to enroll in one of the same Medicare eligible options that you are offered. Healthcare, and especially Medicare, can be confusing. With so many different elements and choosing the right benefits, it can be very difficult. Let's look at traditional Medicare. All of the letters that Medicare uses to represent different elements of coverage can be overwhelming at times, but it's actually pretty simple after you've had a chance to hear their explanations. We have already talked about Medicare Part A and Part B being hospital and medical insurance components. Medicare Part D is prescription drug coverage. Some will obtain a Medicare supplement plan to help offset some of the cost of standard Medicare reimbursement, which is usually the Part A and Part B deductibles and any percentage of services traditional Medicare does not normally cover. In this scenario, you would potentially have up to 3 different membership cards under traditional Medicare. Now let's look at Medicare Advantage. Medicare Advantage plans combine all 3 elements into one plan. Hence, this is where the A, B, C's, and D's all come together with Humana's Medicare Advantage prescription drug plans known as Part C. It combines all the elements of your insurance needs into one plan with one card. No need for any other supplemental coverage. Now let's talk about Humana Medicare Advantage. KRS has been partnering with Humana since 2013, offering the Medicare Advantage prescription drug plans. We have over 50,000 Medicare-eligible retirees, spouses, and dependents enrolled currently in one of these plan options with an extremely high rate of customer satisfaction. What is a PPO? You may be familiar with PPOs from your Kentucky Employee Health Plan coverage, so you know that with a PPO you do not need a referral to see a specialist. A preferred provider organization allows members to go to any provider that accepts Medicare and that also agrees to Humana's terms and conditions. In other words, they agree to bill Humana. That's a great benefit and allows you to see providers you want with greater flexibility. The offerings for coverage for 2018 consist of 2 Medicare Advantage prescription drug plans and a medical-only option. You must have Medicare Parts A and B to enroll in a Medicare Advantage plan. The medical-only plan option is just that, medical coverage only. If you do not want prescription drug coverage through KRS, then the medical-only option is for you. The majority of our enrollment, of 42,000, are in the KRS Premium Medicare Advantage prescription drug plan, with around 5,000 in the Essential option and around 3,000 on the medical-only plan. We'll discuss benefits in the upcoming slides, and you will see why those numbers exist. We will not be going over the medical-only coverage in detail due to the low amount of members that select this coverage, and this will give us more time to discuss the Medicare Advantage prescription drug plan options. But you may be interested in this option, so we invite you to call and speak to a counselor to discuss in greater detail or view the plan literature for more information. Now we will dive into the medical benefits for the Essential and the Premium Medicare Advantage plans. The medical benefits are identical, as you will notice from the chart. Each plan has a $500 medical deductible that you must meet before the plan begins to pay toward any medical services. That means when first enrolling and you go to a provider, you will pay the first $500 out of your pocket. Note that with the PPO option, you pay the same amount for in or out of network services. Everything is considered in-network. After your first $500, the Humana Medicare Advantage plan will begin paying their percentage, which in most cases is 96% of services. For example, you have met your $500 deductible and you go to another doctor's appointment and the bill is $100. You will be billed $4 or 4% for that visit, and Humana will pay $96 or 96%. Once your maximum out-of-pocket for medical services reaches $1,200 between January and December 31st, you will owe $0 for any future medical services. Your $1,200 max out-of-pocket includes the $500 deductible. Let's talk for a minute about Part D prescription drug coverage. Included in the Essential and Premium Medicare Advantage plans is your Part D or prescription drug coverage. Remember, Medicare Advantage prescription drug plans are called Part C, which includes your Medicare A, B, and D rolled into one plan. Let's first talk about the Essential Plan prescription drug coverage. The KRS Essential Plan has the same medical benefits as the Premium Plan, but has a completely different drug benefit. The prescription drug plan attached to the Essential Plan is what is known as a standard Medicare Part D drug benefit model. If you have had any experience with Medicare standard prescription drug benefits, then you will know that there are different stages and percentages of coverage as your spending increases through the year. If you are on a low-cost medication or not many medications at all, then a standard Part D plan may be a good option. If you are on a number of medications or high-cost meds, then it may not be the right option for you. You'll see what I mean after we discuss the differences in the two available prescription plans. The Essential Plan has a $405 prescription deductible. This is separate from the $500 medical deductible. You will pay the first $405 in prescription cost after enrolling in the plan before Humana pays any amount toward prescription coverage on the Essential Plan. This is known as the deductible phase, or deductible stage of coverage. Once you reach the deductible stage, you move into the initial coverage phase, where you will pay 25% of the cost of the medication, and Humana pays 75%, as you can see from the chart. This chart shows the different stages of coverage for a standard Medicare Part D plan or the KRS Essential Plan. As you can see, Stage 1 is the deductible phase. Stage 2 starts at $406, and you stay in the initial coverage stage until your total that you have paid and the total that Humana has paid reaches $3,750. After that, you enter what is known as Stage 3 or the coverage gap, otherwise known as the donut hole. After you enter the coverage gap, you pay 35% of the plan's cost for covered brand name drugs and 44% of the cost for covered generic drugs, until your total cost reaches $5,000, which is the end of the coverage gap. Not everyone will enter the coverage gap depending on your prescription drug needs. Once you reach $5,000, you enter the catastrophic phase. After your yearly out-of-pocket drug costs reach $5,000, you will pay the greater of $3.35 for generic and $8.35 for all other drugs, or 5% coinsurance, whichever is greater. Now let's move to the KRS Premium Medicare Advantage Prescription Drug Plan. Again, the premium plan is what the majority of our members are enrolled into. It offers enhanced drug coverage that you cannot purchase on the open market. This is a special plan that was negotiated by KRS with Humana and Medicare to provide enhanced prescription coverage over and above what is offered in the standard Medicare Part D plan. I invite you to visit Medicare.gov and take a look at the available Medicare Advantage and Part D prescription drug plan options that are open to the public to enroll into. They may have no monthly premium, but if you look at the deductibles and maximum out-of-pocket amounts, you will find that they are substantially more on the public market, even double or triple than what you are seeing here with the KRS medical benefits of both Advantage plans and the prescription, especially for the premium offer. The premium plan has no prescription deductible to meet. It does have the $500 medical deductible, so don't get these two confused. With this plan, it is set up similar to the Kentucky Employee Health Plan, where you have a copayment from day one for prescriptions. You will see there are set copays for each tier or classes of medications: $10 for generic, $30 for preferred brand, and $55 for non-preferred and specialty. Now we'll look at the cost per month for the plans available and the amount that KRS pays on your behalf for coverage. So as you can see, the medical-only plan option is $165.01 per month. The KRS Essential Plan, the one with the standard Medicare Part D drug benefit, is $75.56 per month. And the Premium Plan is $252.51 per month. So with the Essential and the Premium having the same medical benefits, the difference in price lies in the prescription drug benefit. This chart shows what KRS will pay for you, the retiree, if you were participating with Kentucky Retirement Systems that's working and paying into the retirement system prior to July 1 of 2003. Hazardous duty retirees that cover spouses or dependents will still get the percentage paid for spouses and dependents that was previously being provided. If you are a hazardous duty retiree and have questions about a spouse or dependent contribution amounts, we invite you to call us and speak to a counselor. If you have 20 or more years of service, KRS will pay up to $252.51 per month toward your Medicare eligible monthly health insurance. As you can see from the chart, that 75% for 15 years, 50% for 10 years, etc. Next, we move to the insurance benefits paid under the dollar contribution formula. This is for members that began participating after July 1 of 2003. There are two categories for participation, with the only difference being one group must have 10 years to be eligible for insurance benefits, and the latter group requiring 15 years to be eligible for health insurance benefits. Having had the Kentucky Employee Health Plan coverage and being in this dollar contribution formula, you may be familiar with how it works. For current contribution rates, please visit our website. Just like with the non-Medicare coverage, there is still the Form 6256 yearly requirement. If you are a hazardous duty retiree and cover a spouse or dependent child on your plan, you're required to submit a Form 6256 designation of spouse and or dependent child for health insurance yearly in order for KRS to provide the health insurance premium contribution. If you have already completed a Form 6256 during open enrollment, then you will not need to do a new form until next year. If you are a new retiree and have never completed this form, you can submit it with your application for enrollment for the Medicare eligible plans. Keep in mind you will always have to complete this Form 6256 every open enrollment if you are a hazardous duty retiree and cover spouse and/or dependents. Please be advised that under the Medicare Secondary Payer Act, also known as MSP, in certain circumstances, a Medicare-eligible retiree's reemployment with a participating agency of Kentucky Retirement Systems will prohibit KRS from offering or continuing to offer retiree coverage under the Humana Medicare Advantage plans. Please call KRS and Medicare if you have questions. The Medicare Advantage plans include several additional services at no extra charge, including clinical programs for chronic conditions, health management resources, and health coaching programs. Another free benefit is the Silver Sneakers program. It's a very popular program, and retiree feedback is always very positive about this benefit. This will allow you a free gym membership at any participating Silver Sneakers gym or health club. It doesn't have to be in just one location. If you travel or have a summer home, you may find a gym wherever you go as long as there is a participating gym or health club in the area. Another benefit of enrollment in the Essential or Premium plans is Go 365. If any of you remember Humana Vitality, they are now called Go 365. It's a wellness program that's absolutely free that actually gives you free stuff to engage in healthy activities such as walking, going to the gym, aerobics classes, etc. You can redeem your Go 365 bucks for different gift cards and merchandise in the Go 365 mall. Applying for coverage. The application in your packet is a Form 6200, Kentucky Retirement Systems Health Plans for Medicare Eligible Persons. Or, if you don't have a packet or need an extra copy, you may find one on our website. Please complete an application for any Medicare eligible person that is to be enrolled. There are only single plans for Medicare enrollment. If you are covering a spouse and he or she is Medicare eligible, then you would complete an application for you and one for your spouse. Also include a copy of your Medicare card, which is known as the red, white, and blue card, showing your Medicare Part A and B effective dates. You may send it in to our office anytime before your Medicare effective date as long as you have your Medicare card. Just make sure it's in our office by the last day of the month before your Medicare effective date to avoid any delays in your coverage being active. Again, as I said before, the Form 6200 Medicare must be completed for each Medicare eligible person enrolling in Medicare coverage. If dependent or dependents will remain on a KEHP non-Medicare plan, then a new KEHP application must be completed to continue this coverage for them. For example, if you are becoming Medicare eligible and you are currently on a couple plan with the KEHP or Kentucky Employee Health Plan with your spouse, you will need to fill out a Form 6200 Medicare application for yourself, and you will also need to complete a new Form 6200 KEHP application for your spouse for a single plan, making the spouse the plan holder. Or if you're becoming Medicare eligible and you're currently on a family plan, you will fill out a Form 6200 Medicare application for yourself and a Form 6200 KEHP application for your spouse and dependent, selecting the Parent Plus option, with the spouse being the plan holder and the child or children as dependents. If you have a situation that does not fall into any of the categories that we have discussed, we encourage you to call our office and speak to a retiree health insurance counselor Monday through Friday from 8 to 4:30. This concludes our video presentation today. Thank you for viewing.